So we did a study where now there is a lot of data coming up in terms of understanding the tumor microenvironment. You have to have the biologic basis of this tumor microenvironment is important to predict the tumor resistance to various drugs. So we did a study since BTK inhibitors are commonly used. We looked at patients' molecular functional portrait using the tissue biopsies and the tissues, the various samples, and in around 41 patients who were treated with BTK inhibitors, and we looked at the molecular functional portrait where we looked at different type of tumor microenvironment defined by the RNA transcription. And that revealed that patients with depleted tumor microenvironment had poor outcomes and they had a more propensity for developing resistance. Now, how this tumor depletion, depleted microenvironment leads to tumor resistance is a big question. And what has been shown in the literature in other studies is that it's lead to a immunosuppressive microenvironment where the other type of cells such as Tregs, those increase in numbers. And those in turn promote the situation conducive for the mantle cell lymphoma cells to grow. And that is tip of the iceberg explanation for this type of complex biology, but this really helped understand and bring up a new point that we need to identify this depleted microenvironment in the beginning to predict which patients can respond well and which patients cannot respond well. So it's a new biomarker, I believe, but we need to investigate in a larger number of patients. So currently our research is going on in the context of CAR T cells, where we want to do this type of study for CAR T cell patients and predict response.